So we've had a really nice discussion about LDL lowering and its importance and the ways of doing it effectively, hopefully cost effectively. What about risk beyond LDL and that risk associated with elevated triglycerides? Actually, Dr. Navarro, you've done a lot of great work on this area showing that triglyceride elevation, and not even elevation, really high normal levels of triglyceride are associated with excess cardiovascular risk. Why is that, and what can we do to target that risk?
So the epidemiology of triglycerides is really confusing, and that's in part because so many things that increase heart disease risk also increase triglycerides, like metabolic syndrome, poor diet, uncontrolled blood sugar. So whether triglycerides are just a really good marker of a bunch of other bad things or are a bad thing on their own still is up for debate, but the answer is probably a little bit of both. We know from a number of studies that increasing triglycerides is associated with increasing risk. And my team recently published data from a number of the cohort studies showing that risk increases with increasing triglycerides almost linearly, starting very, very low and going up to 150. So we think of 150 as a cutoff for high, but the reality is that even below that, increasing triglycerides increases risk. We've seen similar data from secondary prevention studies where people with established heart disease who have elevated triglycerides are at increasing risk. So whether triglycerides are the modifiable target or just a flag for an increased risk, as a clinician shouldn't really make a difference. So what we should do is look at patients who have elevated triglycerides and include that in our kind of checklist of, is this patient at high risk of recurrent events? And if they are, we need to be thinking about what therapies we can use. I know we're going to talk a little bit about the Reduce It trial, but just as a quick plug on this is I use 150 milligrams as a trigger to identify patients who might benefit from icosapent ethyl, because that was the inclusion criteria for the Reduce It study. So it's a population of patients that we know is at higher risk, but also now we have a therapy that we can use to lower their risk.
Yeah, I think that's really a nice summary of where we stand with our understanding of triglycerides, and you've contributed a lot personally to that understanding.